getting breast augmentation surgery today?
Originally, I wanted to go really big. My original intention was to go hard or go home. I was an A cup and I really wanted to come out with a full D, and I wanted to look like I had breasts finally. So I told Dr. Barrett that, and I was looking at the implant sizes and I really wanted to go large. Dr. Barrett was really honest with me and took his time in explaining to me that the bigger I go, the more I compromise the natural look I desired.
The most difficult part of the operation for Reina was picking the right size for her. She did all her research and she showed us pictures of what she was looking for, which is about 2 cup sizes larger than from what she started. So we really had to meticulously dissect the pocket, and this is important because if you make the pocket too big, then the implant is going to move around. If you make the pocket too small, it's going to be very unnatural looking. And then in the operating room, we had to find the perfect implant for her, which meant that we used several sizers, placing them in the breast pocket and then taking them out, and upsizing and downsizing. And then we would sit her up on the table to see how it actually looked before we finished and closed. And I think that's really important because if you don't see how the implants look with the patient sitting up, then it's really hard to tell how good of a breast augmentation you did and if you hit the right size for what your patient was looking for.
After the surgery, I feel perfect. I feel normal. I feel like this is the body that I was always meant to have. And it just feels like everything fits right now. I just feel perfect. After the surgery, I've had an appointment with Dr. Barrett once a week, and the reason for that is Dr. Barrett wants to monitor the scarring process and the healing process.
Right now we're about 6 weeks out. We've been doing taping. Now I want you to continue with the scar management using a silicone scar gel called Biocornium is what I prefer my patients to use, and you want to use that up to 12 weeks after surgery. You apply it twice a day and you put it right on the incisions, and you can wear your clothes on top, and it will help further reduce the scar and prevent it from being visible.
He just takes really good care of every single detail. He's very meticulous about the scarring and the healing process.
So one of the things you can do is to kind of help open up that breast pocket a little bit and keep it kind of supple is just kind of pinch at the bottom here and then kind of pinch at the top here. It's like I already felt some kind of release of some contractures in there, so I think this is really good for you to do. And you want to kind of pinch here so the implant rises up and then it drops down, and that's going to help bring it down just a tiny bit more for you, faster. I'd say do that for about 3 to 4 more weeks, okay?
Every day is one of those oh my God moments, and I'm just so happy and so grateful, and I walk out with such confidence, and I just feel like so ladylike now. I have, you know, my cleavage, I have my breasts, I have a bra that fits right, and I have everything just fits right. Dr. Barrett is just a stellar surgeon in every sense and every aspect.